can. I also want to point out another service that multiple sclerosis provides. And how many of you are currently employed? Part-time, casual, full-time? I'm still currently employed. Okay, fantastic. So also just flagging for you that we provide an employment support service, and we have Jeff Lawrence here today as well, who can provide information for you that will help you to stay in employment. And we know that one of the main reasons that people might leave employment with MS is around cognition, but also around fatigue. And so that's my segue into introducing our next speaker. How many of you here do feel that you suffer from fatigue with your MS? I think that's nearly every hand in the room. So we know that fatigue affects over 80% of people with MS, and it's certainly invisible, and it's definitely debilitating for many people. And Dr. Jameen is busy devising a way to measure what has previously been unmeasurable, and that's the amount of fatigue that you're experiencing. So Dr. Jameen is an MRI radiographer at Calvary Mater Hospital and a part-time research higher degree student at the University of Newcastle. So no surprises, Jameen works closely with a person that you may have heard of before, Professor Jeanette Lechner-Scott, and the MS team at Hunter Medical Research Institute, or HMRI, on a number of imaging research projects. Jameen's PhD project involves investigation of MS-related central fatigue using specialist MRI techniques. So I'd like to welcome Jameen.
First of all, I have a couple of disclosures. I'm not a doctor. One day I hope I will be. Secondly, I'm a radiographer. I do a lot of MRI scans day in, day out. So my talk about fatigue will have a bit of a MRI flavor, if you put it that way. The talk about fatigue is, I've been doing that for the last 3 years. I deliberately avoided just or intentionally put in the word central in the fatigue in MS. That's the reason I'll touch on a little bit later on as I go along. I'd like to acknowledge MS Limited for inviting me to give you this brief talk, and also Professor Jeanette Lechner-Scott for getting me involved in this project. Basically, I'm going to run through some basic information, not too much technical on MS fatigue, and touch a very little bit on my project that I'm doing as part of the project. And also, I'd like to thank some of you may have seen me behind that little window there driving away the scanner. So thank you very much for that. And I know it's a daunting experience for some of you having MRI for a long time, not just the annual checkup, but in addition to having the standard MRI scans, you will have another an hour. Maybe I'll be lying to you if you say just half an hour. I'll be doing a lot more than half an hour. And thank you for putting up with that. I'll show you that the information that we get, not just managing and you're diagnosing the disease itself, but rather information like this we get in order to get some answers from this research. So, as you know, so anyone knows about MS, you guys know better than I do. MS is a disease with a cascade of multiple symptoms. That's why it's called multiple sclerosis, such as muscle weakness, loss of balance, a limited sensation. Of all these symptoms, fatigue is the common symptom. And 80 to 90% of the patients experience fatigue at some stage during the disease. And out of these almost 70 of them experience a severe form, especially during a relapse. You can see that a relapse coming by experiencing a lot more fatigue or exacerbation of fatigue levels. Sadly or unfortunately, 60% of the patients do not seek treatment. That's because fatigue is invisible. You don't really know how to explain to your neurologist, and it can affect your quality of life in a big way, such as cognitive performance, as Luke alluded earlier, physical activity, and the psychosocial aspect of your life. Now, what is MS fatigue? So a lot of people ask me how you differentiate MS fatigue from normal fatigue. So as you see here, I put an analogy of this, how you charge battery in your phone. So on a normal person, you plug it in when you're tired after a session of exercise or after a flu. You wait for fully charged and you're back up running, you're good. Whereas in MS fatigue, it's constant, it's overwhelming sense of tiredness all the time. You feel like you're always drained. You charge, but you don't feel that you're fully charged. You feel like you're always, this mode. You feel like you don't get that charge all the time. You feel like you're a defective battery all the time. Simple tasks seems almost impossible. Getting to the grocery, getting to the supermarket to get something, no, it's not happening. So when does fatigue affect most? So this is a survey done by MS International Federation, including about 10,000 patients over 100 countries. And they found that almost 30% of the patients complained or experienced fatigue throughout the day. It comes and goes. Whereas only about 7% feel that, I feel fatigued, I feel better now today. By the time you get another day, you feel a lot better. You need to recharge again. So there are different types of fatigue. So when I mentioned central fatigue is all happening in the brain. You feel cognitively challenged. You have decreased ability to concentrate or complete a simple task like filling up a form. Physical motor fatigue, you're dragging heavy. You feel like something on your back. You're walking along, you can't get anywhere. Or on the other hand, psychosocial aspect of fatigue is you're tired, you're just sitting in the couch, you don't have no motivation to do anything, feeling depressed, always emotionally drained. So there are a lot of people ask what causes fatigue in MS compared to the fatigue adult or healthy people experience. So one of the most common theories is the damage to the nerves itself. As you see here, you've probably seen this picture many times. This normal healthy neuron, one that affected by MS, which basically scarring of that myelin, the sheath that covering your nerves. So what happens as the consequence of this, you get reduced signal transmission to the area that you want. So our brain is amazing. So you try to compensate by recruiting other part of the brain to maintain your normal functioning. So what happens is you feel that increased overdrive. And that's what a lot of scientists think, that you feel the fatigue because of that. And this is a study done by Professor Legner Scott 20 years ago using a PET scan, and then they overlaid these images in MRI. And they found that there are some part of the brain, the glucose metabolism is significantly reduced, especially in the frontal and basal ganglia. Exactly what happening is that there might be some damage in the axonal and the demyelination in this particular area, but other than that, we are not really sure what's happening. We know that there's some dysfunction in the pathways connecting these two parts of the brain. Other thing is, the third most common theory that proposed is the dysregulation of the immune endocrine system. So you see on the left side, you see the healthy brain, and these little sharp star-shaped cells, their job is to actually keep a lot of healthy brain processes like supporting your metabolism in the brain, blood supply control. So what happens when you have disease like stress, inflammation, infection? It turns on a lot of other things that we don't know about, such as cytokines. They are like broad-based proteins who circulate around your system, creating a lot of havoc. And what happens is they also turn on all the other things around in your brain. It's like microglia and other infiltrating cells. They all contribute a lot of processes going on, and you find that everything is causing some kind of damage or some kind of overdrive into the brain. And this is I call it secondary factors that causes MS fatigue. Some of the drugs they're taking may be exacerbating your fatigue levels, such as muscle relaxant, analgesic, antidepressant, and even some immunosuppressants. Some studies show even that drugs that you're taking to the DMTs or disease-modifying therapies such as interferon beta can actually worsen your fatigue levels. And sleep disorder is another thing, pain, psychological factors, depression, anxiety, stress. That this doesn't mean that you have to change your medication. I think the best person to tell you that is a neurologist. So fatigue is a problem. It's a big problem because it has a lot of issues around it. Basically, it's multidimensional. For example, you're a normal person, you get normal fatigue, you don't have to worry about all the other things. Whereas with MS, with fatigue, you got sleep disorders, you got environmental factors, you got physical issues and psychological issues. It's all add up, and then you find that you got nowhere to move. It really takes a toll on you. So why is it difficult to identify fatigue? Number one is overlap with other symptoms. A lot of other symptoms such as depression, sleep disorder, your day-to-day thinking, cognitive impairment, and it's unrelated to age or gender or neurological impairment. Doesn't matter how long you had MS to feel fatigue, you feel fatigue regardless which stage of the disease. And it doesn't really matter either whether you're a particular type of MS. So what can we do? I do MRI scan. Can we use MRI to detect fatigue? Not really. So what MRI shows is this little white thing we call plaques, white matter lesions. That doesn't tell you anything about fatigue. So other issues, fatigue, the symptoms of fatigue are related and interdependent. So for example, if a bladder or bowel issues at night, that is going to affect your sleep. And then if you have a lack of sleep, you will have a cognition in the morning, and then it increases the fatigue. Same way, bladder issues, you have a plasticity, constipation, and other issues associated with it. And eventually that will increase your fatigue level throughout the day. Now, how do we diagnose fatigue? So at the moment, it's just we get you to sit down, give yourself a set of questionnaires, we'll get you to remember 4 weeks of your history, see and your medication history, rule out any other issues associated with it. We don't use MRI at all to study or diagnose. To study we use, but we diagnose, we don't use MRI at all. So the forms you fill up, are they really effective? Not really, because it's very subjective. We get you to come in, sit down, oh, there you go, another set of forms. You've got to go through that again. And it captures only one time point. You remember probably 20 minutes of, okay, I'm feeling fatigued now. Okay, we're going to write it down. Or how I felt 3 weeks ago, I don't know. I'm just going to write something I feel now. And it doesn't really account for, you don't think of anything else, but you feel, was I depressed 2 weeks ago? No. Did I have sleeping issues? No. You don't remember all that, so you just write what you feel at that point of time. The solution is take away your thinking or your cognition about fatigue levels, just that we find out what's going on in your brain. The one way to do is do MRI scan to find fatigue, but it's challenging putting you in MRI just to identify or diagnose fatigue. And not only that, it's very difficult to develop and administer. So, but however, MRI has been used to study fatigue over the last 20 years because MRI is a great way of measuring fatigue objectively. So, beginning of my study, I did a review looking at a number of studies, about 200 studies. We come down to about 100 studies and looked at carefully each and every study and what they found in terms of what is pathophysiological mechanism of MS fatigue using MRI scans. So we thought we could really nail down to one particular brain signature. Okay, this is it. We can tell Professor Legner-Scott this is what's happening to the brain, but unfortunately that's not the case. And that also explained why it's difficult for Professor Legner-Scott to treat patients with fatigue. Now, what we found is the number of changes in the brain, not only just one area of the brain, there's many areas in the brain, not only functionally, structurally, chemically. So that's what we are getting at. This is just a nutshell of what's happening, what we found. First thing, this is what you get when you have a standard MRI, these little spots. That doesn't really tell us anything about fatigue. And you give them, sometimes you get this gadolinium or the MRI contrast or the dye injection also doesn't really tell us about the fatigue levels. But then some researchers studied your brain shrinkage, brain loss over the time during the course of the disease. They call atrophy. And they found some areas in the brain actually shrink, and that has a positive association with fatigue. And then others studied are now probably, it's all got to do with functional stuff going on in the functional connectivity of the brain. So they put patients in, get them to do some tasks, fatigue them out, and then measure the functional levels. And they found that some area of the brain lit up, some not. Or they thought areas that lit up makes sense because that might be contributing or recruiting other part of the brain to do the task. And on the other hand, we can actually look at, using MRI, your white matter fibers. What you're looking at, little wiggly things, actually the white matter that we see in our brain using MRI scans. And there's a very good technique because we can actually tell. We found that there's a lot of disruption, dysfunction along several pathways in the brain. And this is a very promising technique that we can use to study fatigue. And then my interest is pretty much you hardly touched on, is actually looking at the chemicals in the brain and finding any association with MS fatigue. That's what I'm getting at. So I'm just giving a brief idea of what is MR spectroscopy. Basically, what you see on the left side of the picture is an MRI scan that your neurologist sees after your MRI scan. That is exactly what you see, but that doesn't tell you anything about fatigue. So what we need to know, what's happening in that area of the brain is, for example, that little square that I put in. We want to understand the chemicals in that particular area of the brain. That's exactly what I'm doing, call it MR spectroscopy. You can call it something like a visual biopsy, like take a sample tissue and putting under a microscope and finding out what chemicals are there. And what we found on the left side is the number of chemicals. I'm not going to go through the details of that. These chemicals are responsible for certain functions. For example, a neuron, how healthy your neuron is, what's happening when that demyelination happens. So each one tells you something. For a typical MS patient, this is how MR chemical footprint look like. Already is one of the chemicals and one is increased. And this is what I'm trying to find out whether or not I can show something that is maybe useful in finding a drug or pharmaceutical approach in managing fatigue. Now, there's another approach that I use is we have a number of chemicals. We drill down to the really core of the brain and take a tissue and then find out small piece by piece. You can get a lot of information there. A number of chemicals we cannot see otherwise. MRI is the best way to see that. And if you call it 2D COSY technique, which allows us to actually investigate a number of metabolites, over 75 metabolites at the same time. So that's what we've got in some patients over 75 metabolites we got, and then how that's going to relate to fatigue. So my study is basically get you in, put you in the scanner, and then do a number of scans, and in addition to the standard scan that you have as part of your follow-up, and then get you to fill in this questionnaires, how you've felt the last 4 weeks in terms of your fatigue levels. This is preliminary report. I found a number of chemicals or metabolites, we call it. Compared to a healthy population, there are a lot of metabolites actually either reduced, most of them are reduced, some are actually increased in MS patients compared to healthy. So what does it tell you? So then I went on to see, okay, it doesn't really make sense. I want to know how many metabolites in this group actually has got any association with fatigue. So I would drill down everything. Okay, good. There's a lot of metabolites actually talking to fatigue, or some way they're related to fatigue. Exactly how they relate, I don't know. There might be some dysregulation going on in their chemical pathways that controls the complex, we don't know, cellular mechanism or events. So what we're doing is trying to establish a relationship between chemicals, brain chemicals and fatigue, and how they behave over time. So some of you may have come back to do the follow-up study so that we can see your baseline, then after your treatment, and see whether the fatigue level changed because of the medication or something else going on, or the disease itself, or you're progressing disease into a different level. And hopefully we'll get an understanding of how fatigue, or give you a metabolic or chemical footprint of fatigue and MS. There are a number of strategies which Nicole will touch on a little bit later on. But basically, when you go to a neurologist, the first thing you will identify the secondary factors before treating the fatigue. I'll ask you whether you have sleeping patterns, depression, infection, what's going on, and get all the medical history. Then we'll sit down and see the approach of whether or not you really require medication. And if you do, none of them actually, not single one is effective at the moment. We'll find out for you the best medication that is available out there. And there are a number of non-medical strategies, useful, beneficial, exercise like a yoga, exhaust these things, energy conversation. Luke talked about a little bit, do things slowly, small one, chunking, and then energy conversation, try to save the energy as much as you can. And some studies, cooling therapy might be helpful, like cold weather might be helpful. Anything that cooling, that helps pretty much. The take-home message is fatigue is not easy to treat, it's complex, and hopefully we're getting some information or some answers through the studies currently going on. At the moment, we have no idea what's going on, to be honest. MRI has a potential, at least providing a number of MRI imaging biomarkers, we call it, or ways of telling you that we can tell something in MR rather than just relying on your questionnaires. And there are many management options which Nicole will touch on, but none of them, to my understanding, is the best. So with that, I thank Professor Legner Scott and my supervisors for getting me involved in this study. Thank you.